Hi, my name is Dr. Moaied Nattah, a specialist in physical and rehabilitative medicine, specialized from University of Sapienza, Rome. We conducted a study with Dr. Simone Tiberti, Unità Spinale, CTO LSC Andrea Alessini, and occupational therapist Leandro Segaletti. I would like to give a special thanks to Professor Marco Paoloni, the head of Department of Physical and Rehabilitative Medicine and of Sapienza, University of Rome, and also a special thanks to the engineer Massimiliano Mangoni. In this article, we present a case involving a patient who has a spinal cord injury resulting in tetraplegia and upper limb functional loss and muscle power weakness. So we invented a program with lead motion controllers to train the fine hand motor function, to train the patient to move his hands with this leap motion controls. These leap motion controls are controls that can trace the hand and show the hand traced as a feedback. So the patient can do some games, to make a physical activity and improve the fine motor hand function. This is the principle of this study. We used scales like Solarman. We documented the experiment with videos, and we noted the improvement in function of the hand by after 2 weeks of therapy. The hand movement is improved in a noticeable way, and the therapy shows a success. I used, as I said, the leap motion controller and Unity 3D to program the game, and the patient can do exercise 1 hour or 30 minutes a day for 5 days or 3 days a week, and by this way the patient can improve his exercises. The good news of this study is that the exercises are very funny and very well made. They depend principally on the function of the patient. Say if the patient can do exercises, can move his hand, he can play this game. If he has a lot of weakness, it will be difficult, because the device can trace hand movement, but if you don't have hand movement, the device can't trace hand movement. So it needs an active hand movement, not a passive hand movement. Compared to robotics, where the hand movement can be a passive, where the robot can move the hand easily. But in this device, the hand it has to be moved by the patient. So I advise you to see this study and make a review and comment. And it's a new study using, as I said, leap motions and device. So thank you for listening. Have a nice day.